Hello, this is Dr. Gay from First Look MRI, and this is a 19-year-old baseball player who's having pain along the medial side of the elbow joint. He had pitched recently and felt some pain in the elbow. And on this view here, this is an arthrogram. We injected contrast over here. You can see some of the contrast in the muscle and went into this lateral part of the joint. This is the radius, and this is the humerus up here, and this is called the capitellum, this part. So this is the radiocapitellar joint. We see this white contrast going all through the joint. And if we look on this side here, we have a ligament, a complex here that goes from the radius to the humerus here. And this is the radiocollateral ligament and the lateral ulnar collateral ligament. The lateral ulnar collateral ligament comes from over here. There it is right there. Comes off the ulna, wraps around behind the radius, and it comes up here and it blends right imperceptibly with this radiocollateral ligament. So it just look like one ligament together. And the common extensor tendon is over the top, but the problem is on the medial side, not the lateral side. So this is the lateral side where we injected contrast away from their pain. Now on the medial side, they have an injury of the UCL, the ulnar collateral ligament. So the UCL has two main bands we see here on MRI. We have a more posterior band, which is over here. We always look at this pointy part. It's called the sublime tubercle of the ulna. Down here, this pointy part, and off of it comes the UCL, and the UCL comes up, and it has an anterior component that is right here, and it has a posterior component right next to it, which is right here. So the anterior component is more vertical, just blends up here. This one looks normal, and the posterior component comes over here to this horizontal ridge. It attaches right here. So there's a tear of this ulnar collateral ligament. This is called the posterior band. A little linear bright band is a partial tear of the UCL, and the UCL is too thick as well. It just looks a little too thick, and there's a, if I really window this down, you see this glaze of brightness around it. So this is abnormal to see this foggy brightness. So again, the UCL is attached to the sublime tubercle. It's not torn off of that. There's a little blip of brightness and maybe some low-grade injury, but there is thickening, maybe related to a little bit of redundancy, and this edema around the in the deep soft tissues here from recent injury. But here where it attaches to the bone, the periosteal attachment, there's that horizontal band that's abnormal. So a partial tear of the posterior band of the UCL right here. Again, the anterior band, which is one slice away, is good, and the posterior band here is partially torn.